Hi, this is the Change of Row Wellness Show, the show for you, the busy professional who wants to live a healthier, happier life with increased energy and productivity. And I'm your host, Jackie Grant, and I'm here with Melissa Gall, who is a fitness and soft tissue professional. And Melissa is also a mother as well as being a holistic core restore coach. Welcome, Melissa.
Hello, Jackie. Thanks for having me on the
Cool.
show.
That's brilliant. So today, what we're going to be talking about is pelvic health. So the core, what we all need to know about the core and pelvic floor dysfunction. So Melissa, just start off by telling us how you got to be doing what you're doing.
Originally, I started off as a normal fitness instructor, but then when I had my first son, at about it was 10 years ago, well, 11 years ago now, I
Mm,
decided to retrain in pre-postnatal. I started to teach buggy classes then. The reason I veered off into more diastasis health and pelvic floor and core dysfunction is because I suffered diastasis recti after I had my second child. So that's
mm.
why I started to sort of naturally come into that sort of field.
Brilliant, great. And so what would you say? Why is it important for people to know about their pelvic health? Because it's not just when you're pregnant. I mean, overall, at any age, we should be making sure that we have good pelvic health. So, why would you say it's important?
Well, because a lot of people have urinary incontinence and they think that that's it. It's just a natural phase of life. But actually,
Mm,
there's a lot that people can do about it.
mm,
And also, if you have things like prolapse, there is ways that you can manage the symptoms by breathing properly, by working your pelvic floor. I mean, if we've got grade one, grade two, you can actually improve a prolapse. If we're looking at grade three, grade four, we have other things that can be applied. And then
mm,
with things like diastasis recti, you don't have to live with it. There are things you can do to improve it. It doesn't have to be exercise. It could be massage. It could be eating better. It could be making sure you're hydrated and getting enough
mm,
protein. So it's not
mm,
really just about exercise. And there's so much that people can learn just by talking.
mm. And why would you say? Because the core and pelvis are like they both kind of work together. You know, in order for us to function that
Mhm.
area. So why do you think that like people should be doing pelvic floor exercises?
Well, with pelvic floor exercises, it's not just about squeezing. The whole breath is involved. So when you exhale and the lungs deflate, you create a vacuum in the tummy and your pelvic floor lifts as well. So it's not
Mm,
really just about doing a squeeze, it's also
mm,
about incorporating the breath and then not just sticking to the Kegels, it's also moving on from the Kegels into movement. Because when people have an accident, it's not when they're stood still or sitting down, they have an accident. It's
mm,
usually when you go and run for a bus or if you're going to quickly pick something up which is falling on the floor. So it's training your body to actually function in those situations. And
mm,
that's why it's important to move on from the Kegel.
mm. And because I mean, I'm sure there's signs that people, common signs that people will know that they have a pelvic floor dysfunction. So what would those be?
So, with urinary incontinence or even fecal incontinence, it's obvious what the problems are. You might not get it when you're walking normally, but if you're running or jumping, then that's obviously that symptom. With
Mm,
pelvic organ prolapse, you've got either a feeling of heaviness or dragging in the pelvis, or possibly lower back pain. You have difficulty with sexual penetration, an
mm,
inability to wear tampons, or
mm,
even an inability to empty the bowels completely. And
mm,
in worst case scenario, it's also tissues physically protruding out of the orifices. So that's for your pelvic organ prolapse. With diastasis recti, it's if you're moving or doing some kind of exercise and you notice a strange doming shape coming down the center. So the six-pack line, the fascia in the center, you get a sort of conical shape when you're doing something which the fascia can't hold in place. So if you've got a diastasis recti and that's happening when you do an exercise, you really shouldn't be doing that exercise. You need to regress the exercise so that you can control and load that fascia. The other symptoms with diastasis recti sometimes is maybe lower back pain as well.
Yeah.
And then there's also when you have overactive pelvic floor. So you could have a weak pelvic floor and you can also have an overactive pelvic floor. And the symptoms of that is urinary frequency, urgency, hesitancy. So, for example, if you want to go for a wee or even a poo and you can't relax the pelvic floor muscles to actually go, if you have constipation, the pelvic floor muscles may not be relaxing enough so that you can have a bowel movement. If you're straining, and now if you are straining and you have constipation, it's actually going to make your diastasis or your prolapse symptoms possibly worse because you're pushing on the weakest parts of the core and the pelvic floor. If you have pain in the pelvic area anywhere, unexplained pain, in the pelvic region, hips, and even during, after, or during intercourse as well. And sometimes there is also spasming of the pelvic floor as well.
Brilliant.
Also, there's the hysterectomy people as well. They may suffer some of these issues because obviously they've had a structure removed from inside the abdominal cavity.
Brilliant. Great. So what are the main things that people could do in order to strengthen the pelvic floor and core?
Okay, so you start off with your Kegel. People may have heard their healthcare professionals or maybe from somewhere else on how to do a Kegel, so pelvic floor exercises. So we're trying to not just work the front part of the pelvic floor, but also the back passage as well, because the pelvic floor is like a sling. So it's underneath the whole of your pelvis in the whole bowl, and it goes from the front and the pubis right to the back where the sacrum is. So when you lift and exhale, when you squeeze your pelvic floor, you need to try and draw in both sides. So it's like you're trying to stop a wee mid-flow, but you're also trying to stop passing gas. So imagine you're in a lift with George Clooney, and you do not want to pass wind. So initially, you want to take a nice breath in and relax the pelvic floor. As you exhale, you squeeze in and then up as well. Now, if we add the breath to that, we actually use our natural movement of the whole area. So as you exhale, the lungs deflate and lift, and the pelvic floor comes up. So then we're using the breath to help lift that pelvic floor as well. So you exhale and lift that pelvic floor. Now, to actually transfer it to movement, you can actually do it in a daily basis whenever you stand up out of a chair. So I'm just going to turn my screen quickly, just so that you can see what I'm talking about.
Yeah.
So if I'm sitting down in my chair, how many times do we stand up out of a chair? So I want you to try something for me. Stand up out of your chair. Do you inhale, exhale, or do you hold your breath? So if you want to try this with me, and maybe
Okay.
the other people who are watching, maybe people who watch, they can try it as well. So stand up and just notice what you're doing with your breath. Do you inhale, exhale, or do you hold your breath?
I inhale.
You inhale. Okay.
Yeah.
So this is where you can transfer your Kegel into your coming out of a chair. So we always exhale on exertion when we're training. So what I want to do is transfer your training stuff. So for example, when we do a bench press, we exhale on the push. When we do a squat, we exhale as we stand. Standing out of the chair is no different to a squat.
Yeah.
So if we inhale and we have a weakness on either because we have a diastasis recti or in the pelvic floor, we're creating an intra-abdominal pressure, which is going to push on your weakest part. So ideally, what we want to do is exhale to deflate the lungs, and then lift your pelvic floor as you stand. So try it with me then. So take a breath in to start, and then you're going to exhale, lift your pelvic floor and stand up. And that just takes the pressure off your pelvic floor, because each time you either hold your breath or inhale, we're bearing down on that pelvic floor. Say you're a new mom and you're holding a baby in your arms, you've got the extra weight there as well. So imagine all that extra load that's going on those weak parts. We're just taking care of them. You exhale, you lift that pelvic floor. And even when you, for example, pick something heavy off the floor, either maybe you're shopping, or if again you have a baby and you're picking baby out of the cot. So you lean forwards and you exhale, you hold your pelvic floor and tummy in, and keep exhaling as you stand. That way you engage your tummy muscles, you've engaged your pelvic floor, so we're protecting them, and you're exhaling to reduce the intra-abdominal pressure. So you're less likely to pull something in your back. So this is just two ways that you can transfer your Kegels into just daily life.
Everyday stuff.
Yeah.
Yeah. So it's funny how I got up and I actually inhaled. Yes. Do you know what I mean? So because I don't really notice. I wouldn't have noticed that until you just said that. Do you know what I mean?
Say if you're a nurse and maybe you work with people moving peoples from one bed to another, male or female, it doesn't matter. Every time you pick something weighty, if you hold your breath or inhale to move that person, if you already have a small prolapse, you could very well just push that prolapse further. So it's so important. You start to get ready to move the person on the bed, you exhale, hold your tummy, and then keep exhaling and move the person onto the other bed.
Brilliant.
So especially people who are taking care of maybe elderly people as well.
Yeah. And that's the thing, because people just think that there's certain times you need to, well, normally pregnancy, that you need to focus on your pelvic health, but you have to focus on it all throughout your life. So
all throughout. And also when we hit menopause as well, our estrogen reduces and our collagen tissue becomes poorer. So we want to make sure that we're avoiding creating a prolapse by protecting them, not necessarily just training them. And this breath management actually really helps to protect the tissues.
Great. So do you want to tell us about, if someone came to you, what kind of screening in terms of pelvic floor health would you be giving them?
So I would normally ask the questions that I would, if there's a symptom, I would ask that question if they have that symptom. So the symptoms I mentioned earlier, I very well could be asking about them as well. So I would ask, have you got a heaviness in your pelvis area? Are you suffering from back pain? Have you got glute pain? Or, just all of these sorts of things. Have you got a diastasis rector? Have you been told? Do you have you got any difficulty inserting a tampon, for example? So all these questions can and should be asked. They may seem irrelevant to somebody who hasn't got the symptoms, but if we're not screening, then who else is? I mean, when I went for my 6-week check after I had my babies, I didn't get asked any of these questions. So all people get missed. They go to high intensity classes. And it doesn't matter if you've had a baby. People who haven't had a baby can get diastasis recti. And people who haven't had a baby do get prolapses. So it's not really about having a baby or not. It's just learning how to take care of our bodies properly.
Exactly. Brilliant. Great. So do you want to take us through a case study of a client that you may have, come across that has had a, pelvic floor dysfunction, and, what kind of outcomes that person's had with you?
So in the last, okay, I've been with this one lady. I've had 5 sessions with her. The first session was a massage. She had a diastasis recti of 3 fingers. She wasn't suffering any urinary incontinence at this point, but she was suffering quite a lot of back pain. Now, a lot of people think to fix a diastasis, you need to exercise. Okay, maybe there might be a little bit of exercise, but I found that massage is normally one of the best ways of reducing tension. So with this lady, she had a lot of tension in her lower back, for example, and she had very, very tight oblique muscles, which are these muscles here, for people who might not know. So we released the back and these, and within the first massage appointment, it had already started to narrow.
Brilliant.
So we would look also at ribs and how she breathes. And within, I think it was 3 weeks, so we had 2 exercise sessions. The first session where we did movement, it was mainly release work, opening up the chest. She was very, very tight through the chest because she was breastfeeding. And opening up through the quads. She was very tight on her quads, so that's the front of the thighs, and hip flexors. So the reason why I was doing these is because, so let me just demonstrate. There's me standing with a bad posture, right?
Yeah.
Chest sort of hung low. So my ribs are pushing down into my tummy. My tummy starts to push outwards. So that is creating intra-abdominal pressure, which I can instantly fix by opening my chest.
Yeah.
So where she had all this pressure coming through the front, we just opened this up for her. Made sure that she was holding her head in the right place, also brought her pelvis in a better place. And then by the second session, we then started to load the muscles a little bit more. But after the massage, after the release work, by the third session, we'd got her width down to 1 finger from 3 fingers.
Brilliant.
And that wasn't including any exercise. Then we also included, we checked how much water she was drinking, how much protein she was consuming, making sure that she's eating the right things, making sure her body isn't inflamed, so we're not putting too much sugar in her, because it's an inflammation straight, it inflames the body. She's not getting a lot of sleep, so we added a little bit of breathing techniques to help down train the parasympathetic nervous system as well.
Yeah.
So all of that, before we even did exercise, we already decreased the diastasis. So
Brilliant.
she's a very happy lady at the moment.
And actually making her feel so much better by the increased hydration, better sleep, better nutrition, making sure she's getting enough protein.
Exactly. And because the tissues we're trying to repair are collagen, it's protein and water. If we're deficient from either of those two, we're not giving the body the building blocks it needs to help repair itself.
So how much protein would you say that someone actually needs?
I wouldn't go by weighing, but I would give the body a little bit of protein at each meal that they have.
Yeah.
So a little bit at breakfast, even to stabilize their blood sugar levels throughout the morning. And then you might not have the sugary snacks mid-morning when you sort of hits the floor. A little bit for lunch, because sometimes people save their protein for their evening meal, whereas we can be giving the body what it needs throughout the course of the day.
Exactly. That and healthy fats, and making sure they're getting enough hydration.
Omega-3s for the brain.
Yeah, exactly.
So anti-inflammatory again.
Exactly. Brilliant. That's great. So, do you want to give our listeners final tips around, core and pelvic dysfunction? What they should be doing. Any final tips, Melissa?
Okay, so as I mentioned earlier, we want to always exhale on the exertion. So if you are doing something which is taxing and you're holding your breath, it's a sure sign that you should be exhaling. So that's literally the top tip that you can take away from this. Make sure that you're not, if you are, if you've got urinary incontinence and you are stopping or limiting your water or your hydration, you're actually making your incontinence worse. Because there's less liquid in the bladder, it's more concentrated, it irritates the bladder more, which means you have to go even more frequently. So you think that because you reduce your hydration, your intake of water, you're going to reduce the amount of needing to wee. You actually increase it because the bladder can't hold on to that. So tip number 2, make sure you're not dehydrated. Very, very important. And if you're not sure and you have any of those symptoms I mentioned before, just go and see a women's health physio. Even if you have no symptoms, maybe you should just go every 6 months. It's like you go to a dentist. Because if you've got something just a little bit happening, you might just be able to catch it before it becomes worse. And then if anyone's told you you need surgery, make sure you go through all the options before, because surgery really has to be the last option, because it can open another can of worms. So
Exactly.
hopefully with those, and if they need to contact me to give them details of women's health physio, there's at least 3 in our vicinity here. There's one I know by Whips Cross, there's another one in Loughton, and there's another one in the East Village. So not immediately next to us, but there's options as well.
Okay. And Melissa, where can people find you?
So you can either email me, melissagall.walker@gmail.com, and I check my emails incessantly, so I will definitely see them. Or they can go to my website where there's all my contact details in there. My website is Melissa Movement and Massage. Okay.
Brilliant. Great. So guys, so we've gone through why it's important for pelvic health, with the common signs and symptoms of, pelvic health, and why you should really, really make sure that you're using your breath, making sure you've got the right nutrition and hydration. So thank you very much, Melissa, for coming on today and telling our listeners all about this. So guys, if you need any support around, your core, pelvic health, even massage, because Melissa also does soft tissue massage, then she's there to help you, and she's told you where you can find her. So take care, and we will be on the show next week with another fun-packed, interesting, giving you more information about health, nutrition, wellness, and how you can grow better in your life. Okay, so take care, guys.
Thank you very much, Jackie, for having me.
That's all right.
Bye-bye.
Bye.